All right. Well, good morning, everyone. It's another fantastic Monday morning here at Health Plan Markets. Thank you guys for being here live on the call on our last Monday of normal time, because tomorrow starts our season officially. First with Medicare, October 15th is the official day that you could take Medicare enrollments for 2025. So the 2025 season starts tomorrow. Please remember that you cannot take an application today. You cannot fill it out. Shop's not going to let you do it anyway. But you can, if you have in-home appointments today, you can, help them fill out the application, get it filled out, and you can leave it there and then come back tomorrow to pick it up. So that's A-okay to do. You just cannot take it and process it today. So just a last reminder there. And so we're going to get going. So before I go any further, remember, guys, our mission here at Health Plan Markets is to improve the lives of our community with affordable health care. Thank you for being a part of that mission as we continue to move forward into a brand new year, 2025. I'm so excited about this year. There's a lot of disruption. We're going to talk a little bit about that and some new tools that are here for you today. But training is important. So as a reminder, we've got to keep one foot in the classroom and the other one in the field at all times. So with that, I'm going to share my screen. And today I'm doing things just slightly different. I am here in HQ, and inside HQ, you're going to see I'm on the home page, and we're going to talk about these updates again in just a moment. But I do want to share with you, going down to learning, this is where your training calendar lives. As a reminder, everyone on this call should have HQ. If you do not have HQ, please let us know so we can gladly update that and get it on your bookmarks, on your website. This is your all-in-one portal to make your life as easy as possible here at Health Plan Markets. So I went down to learning on the left-hand side, and you'll see training calendar here, and this is exactly what I'm sharing with you today. So this week is the 14th. The 15th marks the first day of 2025 Medicare open enrollment. You can officially start taking applications today. We're going to talk a little bit about getting ready for that. Later tomorrow, not a lot going on this week just because it's go time. At 11 o'clock tomorrow on the 15th, Devoted is doing an open training session. So if you don't have much to do at 11 tomorrow, Devoted's still hosting training. And then Oscar on the ACA side is doing a special event over at Dockside in Lake Nona. So if you're into ACA, at 3 o'clock, they're doing a soiree over on the east side of Orlando if you're in that market. Moving over to the 16th, this Wednesday, Ask Al, our very own Al Clancy, is available for a virtual coffee and chat. Think of him as your coach, your advisor, your guru for how to do this business. He's here to help. You can join him every Wednesday at 9:30 throughout open enrollment, so he'll be there as well. And then we've got Cigna doing virtual office hours at 11. And then our very own contracting team is also available at 11. And by the way, I'm sharing my screen right now, but you can quickly add these events right to your calendar. So if you have a Google Calendar, it syncs really nicely. Or you can click the more details, and then that particular event will open up. On Thursday, 10:30, we're doing an ACA training in person. Daniel Franco, which is a partner of ours, has done. Oh, I'm sorry, I'm on the wrong week. That's for next Thursday on the 24th. So I'll come back to that. Sorry, the 17th here at 3 o'clock, we've got HQ intro. So again, for HQ, if you're new to this platform that I'm sharing with you, on the 17th of this week on Thursday at 3 o'clock, you can get a run through on exactly what I'm showing you here today. And then Friday, last but not least, is What About Shop with Tom Ryan. Now, HPM Shop has some brand new features for 2025. Those of you that have already been exploring and getting ready for the new year have seen some of those features, but if you want to get a full run through and a full scope of what's changed for 2025, please join Tom 9:30 on Friday, and he'll give you the rundown. We also have a recorded version of that training, and that will live on HQ here, and we'll make sure to get you that training and video and all that good stuff so you know what's going on. So that's the training for the week. Remember, guys, we got to keep one foot in the classroom and the other one in the field at all times. So I'm here in HQ. I want to go back to the home page, and I want to remind you that we're going to try to skip your inbox this season, meaning that we don't want to overload you with information. You're already getting multiple emails from multiple carriers all day, every day. And even the best of you check your emails maybe once or twice a year. Just kidding. So hopefully you guys are checking your email more frequently than that. But we're going to keep all of the updates and important information here on HQ. Now, these Monday calls are being recorded. So if you do have meetings, just remember that these are going to live on YouTube. But here on HQ, if we have something important, we want to make sure that you see it first here. So last week, obviously, we had the hurricane. It was, a very stressful time for a lot of folks. And so we posted that particular update there. On the 8th, I posted an update about plan year 2025. And these are all of the new updates on what's going on out there in a simplified format for you. So that has been done for you on 2025 final rules. And then on Friday, I posted the M3P program. And I want to talk about that very quickly. You can read this blog here in HQ, but essentially there is a Medicare prescription payment plan that's coming out. It's being referred to the M3P because prescription payment plan is 3 Ps. Not to be confused with an MP3, which is a lot more fun. But M3P is designed to give the Medicare beneficiaries the ability to pay their medications on a monthly budgeting plan. Okay. So I'm not going to go into full details here, but they don't have to pay at the pharmacy. They'll get a bill that's broken down for all of their medications that they pay monthly. It's flexible so they can figure out how they're going to pay it. It's not a savings plan. It's just a way for them to manage their payments. They can begin enrolling in the M3P plan October 15th, but it will not start until January 1st. Keep that in mind. There's no minimum medication cost or amount. So even if they have one medication, they can sign up for the program. But if they do sign up for the program, they have to use all of their prescriptions through that particular plan. They can't just pick one or two. And then they can get kicked out for non-payment, but they will have a grace period of 2 months. Now, if they get kicked out, they may not be able to come back in, so keep that in mind. It's not for everybody, but it's for those folks that may have quite a few medications or struggle to make payments or are skipping meds because they just don't have the money. So, this is a way for them to budget their prescription count and make sure that they get that paid. We found some really good resources here, obviously Medicare.gov. We linked out to that, and then WellCare created an M3P page, which is pretty helpful. But a couple more frequently asked questions. Can people get out of the program? Yes, they can terminate at any time. And then when can they opt in? They don't have to opt in tomorrow. They can opt in through anytime throughout the year, starting tomorrow. Anyone that starts before the 1st, it won't be activated until the 1st because it's a 2025 program. But let's say your member says, hey, I am struggling with medications and it's February. They can sign in February. There's no, situation where they can't sign up. So at any point in time when they first enroll in Medicare or 2 years from now, they just are struggling with medication costs, this is a way for them to do that. All right. So that is the quick questions there. I see in the chat, are those payments included in the $2,000 maximum? Yes. So Part D, the Part D program, and I'm going to write another blog this week about Part D. There is a $2,000 maximum, and this is prescription drug cost, total cost of the drugs. So we anticipate for seniors, it's a very good year for medications. The majority of those folks taking heavy medications or, quite costly or they have a lot of medications to take, they're going to save a lot of money because that $2,000 cap is there. So yes, that is included in that program. This is in addition to that $2,000 cap. This just gives you a way to pay those prescriptions and your copays and things like that. So I'll be posting, again, important updates here. The other thing in HQ I want to make sure that you are aware of is in your enrollment tools, we've got HPM Shop. So going over to HPM Shop, one last check today. Today's the last day that you can double check your selling permissions. We're getting reports of folks saying, hey, this plan isn't on my shop. Maybe it's gold kidney. I can't see my gold kidney. Where is it? Well, we want to make sure that that you did the certification. So if you completed your certification to activate it on shop, you simply send an email to contracting@askhpm.com with proof of your certification. So whether that's the certification itself or a screenshot that your RTS or even the email that you got, you can forward it over to contracting@askhpm.com. Give us 24 to 48 hours to activate it, and it will be good to go. We're trying to resolve these very, very quickly. So as soon as you send over that proof is when we can get it activated. But as a reminder to check your selling permissions, you can go over to the very top right corner where it says your name. You're going to click your name. You're going to go down to account overview. If you see your face, you're in the right place. Scroll on down and you will see all of your active selling permissions for 2025. And you can organize them by state, by carrier, however you want to look for it. And then you can run filters. So there you go. So I can click gold kidney and it will show me that I am RTS for gold kidney for 2025 and my permissions have been loaded here. So just wanted to show that very quickly, and you can mess around with these filters to see what plans you have in which states. Again, if you're missing one, please make sure you send an email with proof that you are ready to sell to contracting@askhpm.com. Very important. Let me pause there. There's a question in the chat there. Michelle's asking, so would it be fair to say that the most someone would pay monthly on the plan is $2,000 divided by 12, also known as $166, I believe? Well, not necessarily, because the $2,000 is the total cost of the drug, not just what the member pays, but what the plan pays and the manufacturer pays. So it wouldn't be $166 per month. It would be whatever their copay or coinsurance would be up until the cost of that drug or the cost of their drugs reaches $2,000. And then at that point, it would be zero. So it would actually be less than what you're expecting there. So again, very viable as far as the program is concerned. All right, shifting gears here, I'm going to turn off my screen because we're going to talk a little bit about situations that are happening out there. We have announced that there are several plans that are doing a service area reduction or a SAR, or maybe they're terminating certain plans in your market, whether that's PPOs. There's some HMOs that are going out, some D-SNPs that are going out, and I want to give you rules of the road for this. Number one, if one of their plans cancel and they want to go on a supplement, there will be no supplement underwriting, okay, because of the termination. So no underwriting necessary on supplements if somebody is on a Medicare Advantage plan and they do want to sneak on over to a med sup. They can do that without underwriting being done because their plan is terminating. The other thing is if somebody loses their plan, they don't have just until December 7th. They actually have until December 31st to change their plan. So they'll use an SEP, plan termination, and they'll have up until December 31st because their plan terminated. Okay. And then moving into OEP. Now, if a member lands in OEP and they're back on original Medicare, remember they can't switch to an MA plan without a special election period. Okay. So just because they lost their plan, they're back on original Medicare, they must use an SEP in order to get enrolled. So if their plan terminated, I believe they'll have an additional 60 days beyond January 1st. I have to double check that. But they have up until December 31st for 1/1 effective. And then they'll have 60 days beyond that to choose a new plan in their area. Now, this last minute, I also want to bring about that Hurricane Milton is expected to give us quite a few hurricane SEPs. It seems like we're in a perpetual hurricane SEP situation. So we expect to have SEPs and beyond. So keep that in mind as we move forward throughout 2025 and into the new year. All right. Woo, that was a lot of talking. So I would like to reintroduce our special guest today. We have Katie from Gold Kidney, I believe, is on the line. Katie, are you there?
Yes, hang on. I am. Can you hear me okay?
Yeah, we got you. There she is.
Straight from my car. I found a parking lot so I could be with you all today. So excuse my background. I'm heading over to Miami, so I had to make it all work. But good morning. How are you?
Excellent, excellent. Thank you for joining the call on the road. We really appreciate your time. I know you're running heavy, and I mean, it's the last day before open enrollment, so pray for us,
It is.
right?
Oh yeah, of course. And I want to say happy AEP. We're almost there. I know we've all been out working hard, going to all the trainings and preparing. And then also just I know there's people, I'm looking at names from around the state. I hope everything is okay if you were affected by the storm, that things are on the mend. And know it's been a little bit of a rough week. Yeah, hey Rosie, for a lot of people. So just thinking about everybody here and not just us, thinking about the seniors too, living in the mobile homes and all the different, the older homes and things going on. So just giving each other grace and being sensitive to the situations around, but just happy to join you today. And most of you on this call, I think, have been to some sort of training or rollout with us, but we are a newer carrier. So sometimes you have to hear things a few times for them to sink in. It's important. I know that's how I work anyways. So what I did today is I really condensed a presentation just to kind of give you a highlight and a reminder of who is Gold Kidney, how we can help your clients and partner in the field. So with that, because I am on my hotspot and it is behaving pretty well, generally I'd stay on camera, but I'm going to go off because I'm going to use my internet to its full potential. So hang on one sec, please. And I'm going to share my screen.
Oh, wow. Look at you, Katie.
Bear with me for just a second. All right. Entire screen. Share. Hoping this is going to work.
Yeah, and while you're doing that, I'm just going to puff up Gold Kidney a little bit. This is a new plan, not new. They've been around for a little bit, based out of Arizona, and this is their second AEP here in Florida, and they're already expanding. So pay attention because they're growing fast.
Thank you for that, Justin. Can you see my screen okay?
Beautiful job.
Wonderful. Thank you. So exactly like Justin said, Gold Kidney Health Plan, as many of you know, we're a Medicare Advantage carrier. We're headquartered in Arizona, going into our third AEP out there, second AEP here in Florida. Justin said it right. We're expanding, as you'll see, from 9 counties into 22 for 2025. And I'm actually already having weekly expansion calls for 2026. You can expect us throughout most of the state at this time next year. So as a reminder, Gold Kidney Health Plan, again, we're headquartered in Scottsdale, Arizona. We are a Medicare Advantage carrier. We have a full portfolio of Medicare Advantage plans. So our name doesn't necessarily tell you that, but we have Medicare Advantage plans that are traditional standard plans, non-CSNP plans, but we really specialize in offering CSNP plans for individuals in the areas that we serve that have the chronic illnesses that oftentimes lead to CKD or chronic kidney disease. Those are things like diabetes, CHF, cardiovascular disease. So we have really unique, specially tailored CSNP plans for heart and diabetes. And then what makes us very unique is we also have Medicare Advantage CSNP plans that are tailored towards individuals that unfortunately may have progressed along in their kidney disease and they're on dialysis. The great thing about a CSNP plan, if you don't already know this, they're great during the annual enrollment period, but they have a year-round SEP. So it's a year-round way to help your clients and grow your book of business. Gold Kidney was started by a group of over 100 nephrologists that meet with patients every single day that have voiced that they don't really have a healthcare plan that meets their needs. A lot of individuals that are chronically ill, they have a list of drugs that is really concerning sometimes. There are 10 drugs on a list, but they have just as many or more doctors that they see sometimes. So it's really hard for them to afford their medications, their co-pays to see the doctors. And a lot of times that affects other social determinants of health, such as being able to buy healthy food or obtain transportation. So Gold Kidney came together, these nephrologists, and developed Medicare Advantage plans that are really tailored towards our members' needs. They have low to affordable co-pays for the services that our members use the most. A lot of rich additional benefits tailored towards our members' needs to help them overcome the challenges they face with those social determinants of health. And then a lot of extra TLC with the care management that we offer to help close gaps in care. As you look throughout the state, you've met these individuals in person, you hear them on calls, but this is our local market team. We're here to help you. We have market managers that handle each market. Ray Gomez and Mario Unco, they really team up in that South Florida, up the Treasure Coast into the Seminole Osceola area. They are your team here. If you have questions or needs, want to talk about business planning, that's who you would reach out to in that area. Justin Hall and Dorian Escalante team up in that greater Tampa Bay area, and I know there's quite a few of you out there. And then we have Miss Denaria Kamore up in the Jacksonville market. Now, if you ever have questions, I would say the first phone call, you could call who you want. I know you're going to be calling Justin and his team. You can call the local team, but you also have access to who we call our Gold Bar, which is our broker assist and resource team. If you, for some reason, can't get a hold of us locally, give our Gold Bar team a call. Email them. They're here to help with plan questions. If you need help looking up a doctor, enrollment support, we're here from you from a national down to a local level. So just to kind of remind you of the types of plans that we offered, which I mentioned. For 2025, we have a couple different types of CSNP or chronic special needs plans. We have what we call Gold Heart and Diabetes. That is a CSNP plan for individuals with Medicare that have type 1 or type 2 diabetes, and it could be because unfortunately sometimes people have both of these conditions, or they have heart issues, they have CHF or cardiovascular disease. That's how they would qualify. We also have what we call Gold Heart and Diabetes Complete. Many of you know this, but anytime you see the word complete after one of our plans, it's a CSNP plan, so they still have to qualify with those medical conditions, but it's geared towards individuals with full Medicaid or with cost share protection. So those levels would be QMB, QMB plus, SLMB plus, or FBDE. And really those complete plans, they're CSNP plans, but they're competing with the dual plans on the market. And they're very competitive for this upcoming year, by the way. We really amped up the benefits. And it's a year-round SEP since it's a CSNP plan. So we have the Gold Heart and Diabetes plans. Then we also have Gold Dialysis. And I would say more people qualify for Gold Heart and Diabetes, which we're going to talk about, but Gold Dialysis is what makes us truly unique. If you've been doing this for a while, you know that it's been since the year 2020 since individuals with ESRD on dialysis could actually join a Medicare Advantage plan. But as you know, they're paying 20% for dialysis, going 3 times a week, and oftentimes meeting their MOOP. With our plan, they pay nothing for dialysis, unlimited transportation, and we really address all the different challenges that they face. So we have that Gold Dialysis plan, and we also have the Gold Dialysis Complete plan. And again, that's for individuals on dialysis that also have full Medicaid. That's our CSNP suite. Looking at the bottom 2 bars on this page, the Gold Advantage plan, that's our traditional MAPD. It's just a standard MAPD plan. Maybe someone doesn't have a chronic illness. Maybe their spouse does, and they want to be with the same carrier. This is a very competitive plan. We also have what we call the Gold Loyalty Plan. This is an MA only plan, really geared towards the veterans population that uses the VA facilities for a lot of things, but they just want to give back in some of that outside coverage. Just as a reminder, not that I don't love Arizona. If you sell in Arizona, we've expanded out that way, but selfishly, I'm going to be focusing on Florida here. Looking at Florida, the gold and the blue areas, this is our service area for 2025. The blue area is where we have been. The gold area is where we're expanding into. So we're going to be in 22 counties. Again, members have to be a permanent resident to join the plan, but they can use the plan wherever they travel, even out of state. In 2024, we had a footprint where we could serve just over 1.7 million Medicare eligibles. In 2025, we have the potential to serve just over 4.5 Medicare eligibles in the areas we're going to be in. As you're going to see on an upcoming slide, something you really want to pay attention to, because a lot of brokers are like, I'll just focus on, the SNP plans after AEP. No, we want you to think CSNP first every time you're meeting with a client during AEP, because 40 to 50% of your clients have a heart issue or diabetes where they're actually going to qualify for one of our CSNP plans. And those CSNP plans are tailored towards their needs, which is going to help with member satisfaction, which means it's going to help you with member retention. So we show this slide all the time, but this is, again, telling you how prevalent these conditions are and how many people qualify for a CSNP plan versus just a standard MA. Looking specifically at kidney disease, diabetes, and high blood pressure are the most common causes of CKD. They account for 70% of the causes. More than 1 in 3 adults has some sort of cardiovascular disease. Diabetes, as we know in the United States, is a growing epidemic. 1 in 10 people have diabetes, 3 in 10 have prediabetes. With kidney disease, we're trying to control some of these conditions, such as diabetes, heart issues, hypertension, because a lot of times if you could control those chronic conditions, it slows the progression of kidney disease so people don't end up on dialysis. They call CKD, it's sad, but it's called the silent epidemic or the silent killer, because most people do not know they have CKD until they're in a later stage, but they often know they have these other comorbidities that go hand in hand. I love this slide, and that's why I included this in here again. As most of you know, with CSNP plans, Medicare says that carriers like Gold Kidney can possibly build our CSNP plans around 15 different conditions. Carriers will pick and choose what conditions they want to build them around. I mean, there's some competitors, COPD plans are pretty popular. We don't have them. Even in South Florida, they have HIV CSNPs, for example, we've been seeing. With Gold Kidney, we can address 4 of those 15 conditions. We address diabetes, CHF, CVD, and end-stage renal disease with dialysis. The important fact, which we've talked about, is in 2026, there's going to be a 16th condition allowed, and that's going to be chronic kidney disease. So we're already poised to do very well with that. And as we're partnering in the field, it's going to lead us into 2026, being able to offer that plan as well. Again, there's 67 million Medicare eligibles approximately throughout the United States. 32 million of them have diabetes or a heart issue where they would qualify for a CSNP plan. But again, only 2% of those individuals are on a CSNP plan. Most of them are on a standard MA, original Medicare, and a supplement. So just trying to open your eyes as you're sitting across from your clients. Look at their medications, ask some probing questions. If they qualify for a CSNP plan, they're most likely going to be better served by it. Just showing you how prevalent chronic conditions are with seniors. About 86% of them have at least one chronic condition. 60% about have 2 or more. And then looking specifically at those with end-stage renal disease or end-stage kidney disease, it's tomato, everybody says it differently. Less than 1% that could actually be enrolled on a CSNP plan for ESRD on dialysis are actually on one of those plans. Instead, they're paying 20% for dialysis. And it's simply because they just don't know these plans exist. So we're trying to work with brokers and providers at a grassroots level to really get out there and say, hey, there's a plan out there that could be meeting your needs a little better. And again, these CSNP plans that we offer year-round selling opportunity. I actually met up with a broker in a parking lot yesterday. It's that time of year, Rib City. And I gave him some enrollment guides and point that out. We go wherever we have to go right now. But as I was talking with him, he's like, Katie, I've been doing this for 25 years. I was ready to pretty much hang it up and retire. And your plans are the first ones that have actually given me a little excitement since I can remember. So he's going to get back into doing this year round with us because it's such a good opportunity to help people and still do business. I'm not going to go through all of this. You probably have it, and if you don't, we'll send it to you. But what these next slides are demonstrating is by county, just showing you the point that if it looks by county, lists Medicare eligibles and how many people have heart issues, diabetes, and conditions that would qualify them for our plans. And it's darn near 35 to 50%. Just depends on the county of Medicare eligibles qualify for a gold kidney C-SNP plan. It's wild. Again, I love the big cities. I'm like a country girl. I love the rural areas. I just feel like there's a higher percentage of the chronically ill, a higher percentage of individuals that are lower income that could benefit from our Medi lookalike plan. So just a lot of clients and people out there that we could be helping. Again, focuses for us expansion now and into the future. You'll see state expansion possibly in 2026 as well. Innovative benefits, which we'll talk about. You're going to see a lot of plan stability. Justin was talking about carriers exiting markets. There's also a lot of talk of plan degradations. With gold kidney, improvements and enhancements and stability is what you're going to see. Growing our network. This is, as a new carrier, this is always important, and we continue to grow our network every day. For those of you that are over in the greater Tampa Bay area, like more Sarasota, Manatee, DeSoto County, for example, we just signed Manatee County Rural Health Friday, maybe, MCR. They have like many locations. They're multi-specialty practice. So they just came on. Tampa General, Cleveland Clinic, Moffitt just came on. Literally, we keep saying this, and when the contract is signed, I'll probably do a happy dance. Shands is just about on. They call signing day this Friday. So again, I will be dancing when we send that email out because it's been a process. But Shands is about to be on, and quite a few others. So I know Justin said you get 1 million emails, but keep your eyes open because we're going to be sending those announcements soon. Probably the most talked about benefit for us this coming season, all of our C-SNP plans, heart and diabetes or the ESRD plans, are giving our members a free cell phone with unlimited talk, text, and data. The vendor we work through on this is called Thrive Mobile. They go off the T-Mobile towers, so there's like almost a 99% coverage area in Florida for those that we're going to be serving. I have one of the phones at my house. It's very nice. It's a Motorola Moto G stylus smartphone. And it's so cool because it's a normal phone. It comes to the customer's house, but it comes preloaded with gold kidney apps. So when I opened up my phone, there was an app where they could click to call transportation, click to call customer service, click to get to the member portal. We're trying to make healthcare easier and help them use their benefits. The more they use the benefits, the healthier they are, and the stickier they are, they won't leave the plan. So when you're doing your enrollment applications out there, there's a little spot where you can mark upon enrollment if they would like to be a part of the cell phone program or not. If you mark yes, they'll have one shipped to their home before January 1st. They can port their existing phone numbers over. And we actually have through Thrive mobile assistants that can remote into their phones and help them, with whatever they may need. So I'm excited about that benefit. If you can't tell, it's really different. It's innovative, and we're the only ones doing it in Arizona and Florida. So another thing we're doing, we currently already have a flex allowance. Our members, they receive a gold kidney member ID card, but they also receive a Visa card. Allevi is who administers all of our extra benefits. So any benefit that has a monetary amount, that amount is loaded onto that Visa card, and it has purses in it. So when they swipe it, they know where to take it from. But our plans already have a flex allowance for dental, hearing, and vision. We're continuing that, but also it's enhanced in that it's going to roll over from quarter to quarter. What we did also add is a separate flex benefit. So a separate amount, there's going to be a monthly amount loaded on for what we call gold perks for our traditional plans. or Gold Perks Plus More for our C-SNP plans, they're going to get a monthly allowance that they can use for OTC, utilities, fitness fees, therapeutic massage, pet care. There's a whole host of items. We can get you the list. In addition, transportation, we listen to our membership, and a lot of them say, we love that you give us rides, but we drive, or our family members drive us. So what you're going to see on some of the plans is that we added a combination of trips. So we may cover 20 trips, but we're also going to give them a monthly fuel allowance as well that they can use towards fuel or ride share. So they can kind of, what we say, pick your own adventure, pick what works for you. And then on our dialysis plans, we have to be very thoughtful. We try to think, what do our members need? Many of our members, they're in line for a transplant. I think we've had about 4 or 5 successful transplants so far, but before somebody can even be approved for a transplant, they have to have dental work done. They have to make sure there's no infections in their mouth before they can be approved. So in addition to the dental, hearing, and vision flex allowance, we actually added $500 additional in dental for these members. Also, before members can be approved for a transplant, they have to prove that they have post-transplant caregivers at home. And a lot of people don't. They're isolated. They maybe don't have family to help. So what we did is we added 4 to 6 weeks of post-transplant caregiver benefits in these members' homes to help them get approved for the transplant. Common features on our SNP plans are heart and diabetes and end-stage renal disease. Justin talked a lot about Part D benefits. Yes, there is that cap. There's no more gap. But what you need to look at is what happens before they reach that $2,000 limit. With Gold Kidney, it was important to us that our members access their medications as easy as possible. So we have no deductibles on any of our plans, no split tier deductibles, no deductibles at all, coverage from day one. Our copays have stayed stable or actually decreased, so that's good. And we have chosen to keep the most robust formulary through MedImpact, which is who we use. So strong drug coverage. Copays for specialists on all of our SNP plans are $0 for key specialists, cardiologists, cardiosurgeons, endo, nephro, and new for 2025 based on member feedback. They also pay $0 for vascular surgeons now. Any other specialists are a reasonable $10 to $15 copay. On our C-SNP dual lookalike plans, those are our quote unquote complete plans, C-SNP for the full Medicaid recipients. We amped up our dental, hearing, vision, food, and all our additional benefits so we can compete with the dual plans on the market. On all of our plans, we chose to keep Papa's Pals, which is that in-home companion care, 60 hours a year. A lot of our members need that extra TLC, and we also kept the fitness program. This slide here is important for me to talk about with you because we want you to understand, and this is what a lot of agents, I would say, as we were going around the state, especially in Broward and Miami, really appreciated this, even more than the benefits on the plan. Our HMO plans are friendly, I could say, because they are all an HMO POS or point of service, every single plan we offer, no referrals required for anything, limited prior auths. There's hardly a prior auth on the plan. And then on top of that, our members have a point of service benefit for every single benefit on the plan. And what that means is they can go in or out of network on this HMO, no referrals, same cost share, same MOOP. So if they go to a specialist out of network and it's $0 in network, it's $0 out of network. The key is any Medicare Advantage plan, if it has an out of network benefit as a broker, reaching out to those out of network providers and seeing if they will bill the plan at the time of service. With Gold Kidney, unlike some of the others out there, if the out of network provider bills us, we pay 100% of Medicare and we pay within 30 days. So a lot of flexibility there. And if you guys ever have questions on this or you need help calling a doctor or something, let your market manager know, let me know. We're happy to help. So this is an eye chart. Instead of having a bunch of different slides, I wanted to, just kind of show you what we have around the state, and then I'll send it to you. And if you go on goldkidney.com today, Gold Kidney, we have these plan comparison charts that you're seeing up here. We have the PDFs for all the plans. So this is all available to consumers and brokers. But this is what I call the C-SNP plan comparison for most of Florida. So in 21 of 22 counties, because Miami always has to be different, but this is your plan comparison for Broward, North, and around the state. The plan numbers are the same. The formularies are the same. It's simple. We have Gold, Heart, and Diabetes on your left-hand side. And again, C-SNP plan, they have to qualify with heart, cardiovascular disease or diabetes. And highlights on here, I'm not going to go line by line, but there is a $120 give back for Part B for this plan. We actually decreased the MOOP from $3,000 to $2,700. You'll see those copays, $0 to those key specialists, $0 to the PCP. And again, that's in or out of network. And $10 to any other specialist, like a dermatologist, for example. Your inpatient hospital care decreased. It went from $175 a day to $150 a day. So all good news there. I will point this out, and you might be like, duh, Katie, but I still do want to point this out. You see dialysis says 20% here. If they are on dialysis, they should not be on this plan. They should be on the dialysis plan, and that's where they'd pay $0. So RX coverage. If you're looking at the RX coverage, again, just highlighting no deductible. No percentages. They have these copays where they can either go to a pharmacy over 65,000 nationally, or they can use our 100-day mail order through Birdie. Copays are low. I do want to highlight that for tier 3, which all those diabetic drugs are included in tier 3, like Ozempic, Mounjaro, Still, Trulicity. Mail order, $40 for an 100-day supply for tier 3 meds. So nice deal there. Looking at the extras, dental, hearing, and vision, you can kind of see the amounts. They're on a yearly basis here. It's really quarterly though. But $2,800 a year is what our members receive for dental, hearing, and vision. They get the smartphone. They get over $1,000 in healthy monthly food benefit. They receive transportation on this plan. Gold Perks Plus, that's that monthly allowance that breaks down to $25 a month for utility bills and more. The Silver and Fit, the companion care. And one thing we don't talk about a ton, but I think it's a great benefit, personal emergency response system. We go through Connect America. When a person presses the button on their bracelet or necklace, a live person is there. It's a concierge service. And that live attendant can call the ambulance, but they can also call a family member or a doctor. It's a little more personalized. So Gold, Heart, and Diabetes Complete. Again, this is your C-SNP plan for full Medis. As you look down the line there, if they have full Medicaid, they'll pay $0. There is no cost share. They pay their extra help amount for drugs, and they get a little more on the additional benefits, $3,800 a year in dental, vision, hearing, the phone. I think it's $175 a month that comes to. I'm not good at math, but $2,100 a year for their healthy food allowance, the transportation and fuel, gym membership, all the bells and whistles. Gold dialysis, again, I would say in Florida right now, there's just about 40,000 individuals on Medicare, also ESRD dialysis, and unfortunately that number is growing daily. Heart and diabetes, again, up to 50% of your customers will qualify. Gold dialysis, a little bit less, but if you run into these individuals, this plan is life-changing because the 3 benefits that social workers and clinicians say our members need the most, cost of dialysis covered, which we cover it. There is no cost for dialysis on this plan. We eliminate that 20%. They get all those $0 specialty copays, so they're not having to worry about that to see their key specialists. Looking at food, they're receiving just over $1,000 a year for healthy food. Food is medicine. We're helping them afford it. And on this particular plan, unlimited transportation. They're going 3 times a week to dialysis, and it's reliable transportation. That's what's important too. So Gold Dialysis Complete, again, this is a dialysis. They qualify by being on dialysis, but it's a plan aimed towards your full Medis. So everything's covered at $0, and they get a little more, $3,000 a year for dental, hearing, vision, $100 a month for healthy food. On this particular plan, since it is a C-SNP plan, these complete plans, they're C-SNP plans for full Medis. They are on this plan, but if they exhaust their additional benefits on this plan, they still have their additional transportation, for example, through their state Medicaid or MMA program that they could use. And when you're looking at our complete plans, I hear a lot of agents say, well, company ABC gives us $250 a month for these benefits. Well, okay, we break it down a little different. Our benefits are separated versus just putting it into one lump sum. So if you look at what we do, add up everything we're giving, I would say in most cases, it's the same as or more than a dual plan. Plus, for all of our CSNP members, they're entitled to in-home care management through an outfit called Duo Health, where if they agree to it, they could have a nurse practitioner, a social worker, and a care navigator that lives in their local community come into their home and make sure they're being taken care of and help close gaps in care. And that's not once a year or twice a year, that's weekly if they wanted. Okay, here's Miami-Dade. Miami-Dade only has CSNP plans. We have the Gold Health, which is the heart and diabetes plan. We have the Gold Heart and Diabetes Complete, which is the CSNP for full Medi-Medi. We have the Gold Dialysis down there. It's their own plan, and Gold Dialysis Complete for full Medi-Medi. And as you're going to see on Gold Health, for example, or Salud de Oro, that's the heart and diabetes plan down there. We can't give everything away at no cost down there because we're brand new, but we do have lower MOOPs, lower cost shares, and we amped up the additional benefits in Miami a little more. For those of you in the Miami-Dade area, we are, with our network, we are contracted with about 4 different MSO partners down there. I would say 2 of them are really giving us quite a few PCPs that we're bringing on. So a lot of it's about provider relationships down there, which we are establishing and have. And then our plans down there, again, only CSNP plans, but very affordable, lower MOOPs, lower cost shares, more additional benefits. And then we also have our traditional MAPD plans in all counties except Miami-Dade. So Miami-Dade is only CSNP. So in the other 21 counties, we have Gold Advantage, which is our traditional MAPD. Has a $135 give back, monthly premium 0, pretty reasonable MOOP, PCP 0. All specialties on this plan are specialists are $20. So if you have somebody and they have heart issues or diabetes, they should really be on a CSNP plan. This is more for the non-chronically ill. But what we did is we amped up the dental, hearing, and vision. Last year on this plan, dental, hearing, and vision was only $1,300 a year. We amped it up to $2,000. We added the gold perks, the monthly flex benefit, preventative rewards on all of our plans. Members can receive up to $300. They get the gym membership, the companion care, and the drug coverage is still no deductible and very much stable copays year over year. And then for our veteran friends, we have the Gold Loyalty MA only, $160 give back for the Part B. We increased that year over year, and you can look down the line, but there is 0 for primary, 45 for specialists. We did increase the dental, hearing, and vision to $2,500 a year. Gold perks, that monthly flex benefit, the gym, and companion care. So quite a wide variety of plans. One thing I didn't mention on our CSNP plans, we bypass the insulin copay of $35, and it's actually 0 for insulin on those plans. That's important. Just want to mention a couple programs we have going on. AHIP reimbursement program, selling gold kidney is as easy as 1, 2, 3. We did this last year as well. If you turn in 3 enrollments for us during AEP with a 1/1 effective date, we will reimburse you in your January check $175 for your AHIP. And again, I think most people have heard this. We were excited to announce that we're continuing with our health risk assessment program. For gold kidney, it's especially important that we get these HRAs done for our members because most of them are chronically ill. So we want to know their situation right away from day one so we can serve them as they need. With gold kidney, you have 14 calendar days to get the HRA in. It's probably easier if you do it, when you're enrolling them. and you have to do the HRA on Evolve, which is our internal system. So on our standard MA plans, we are providing a $50 HRA. On the C-SNP plans, which are the heart and diabetes plans, it will be a $300 HRA, and those dialysis members, $400 HRA on those plans. So excited to be able to continue that program. It definitely helps us to get that information, and it encourages you to get it to us. So with that, I just want to thank you for having us. And again, encourage you, think C-SNP first this AEP when you're sitting with your clients. Half of them probably qualify for our plans in their service area, and we are really trying to improve the quality of life and delay disease progression for chronically ill Medicare eligibles throughout Florida. So, give us a chance. If you have any questions at all, please reach out. We're so more than happy to help. And I don't know if anyone has questions right now. Is there anything in the chat, Justin?
Yeah, there's a couple questions. The first one was, are you in Volusia County? And I said, not yet, but for Seminole in 2025. So that's the county just south of where they're at.
Yes, true. Volusia is a 2026 play, but we are in that area more like Osceola, Seminole. Yeah.
Perfect. And then Rosie's asking, will the phone application be on Connecture? Because we use Connecture for our enrollment platform. Will there be an option for them to select the phone on the e-app?
So thank you. That is a good question. And just side note, we'll take your enrollments any way possible, whether it's paper, Connecture platforms, or Evolve, which is our internal platform. And yeah, the application is the same, whether it's paper on Evolve or in Connecture. So there'll be a little spot where you can mark that they want to take advantage of that cell phone benefit.
Fantastic. And the last couple of notes is from me. Looking at the new Medicare rates for 2026, your commissions, it's $626 for a new to Medicare, guys. And then Katie's giving you an extra $400 to fill out an HRA for those dialysis folks, because most of those dialysis folks are on usually straight Medicare, just because of how things go. So, you can earn $1,026 on an enrollment in one of those folks right there for Gold Kidney. That's incredible. So if you're not taking a look at the monetary value on that, it's important too. And then lastly, I'll say, if you haven't really figured out the strategy, it's obvious. Go to the dialysis centers and share the good news. Obviously, the ones that accept Gold Kidney, get in there, because there's probably not very many agents that are thinking this way. Everyone's going to the PCPs and fighting for that business. Meanwhile, you're going in and you've got no competition and an incredible product that Katie just showed you. So that's my 2 cents. Anything else you want to add, Katie?
Yeah, no, I love that, the provider. And that's actually what I'm doing today. I'm going over to meet with some cardiologists for our heart and diabetes plan. They're very interested in it. So yeah, it is, thinking about your clients, thinking about your book, who maybe has these conditions, we can help them, but working with providers. And we're contracted with all the dialysis major ones you could think of, and some of your minor ones. So much we could talk about, but feel free to reach out after, and we're excited about this plan if you can't tell. So we're happy to talk with you and help as much as we can.
Awesome. Katie, I know you're super busy. Thank you for an incredible presentation on the go. You have earned your paycheck this week, let me tell you.
Thanks. Good luck to everybody, and I just wish you the best AEP ever.
Thanks, Katie.
Thank you. Talk with you later. Bye.
All right, everyone. That's it for today's call. Thank you guys very much for sticking around. Again, we're going to continue these calls every Monday morning throughout AEP. Just know that if you miss one because you've got client appointments, we understand they are going to be hosted on YouTube. So if you haven't yet, please make it out to our YouTube channel and we'll get you set up. I did see a request for Katie's info. Just shoot us over an email at support@askhpm.com and we'll connect you with Katie by phone and email if you need that. But thank you guys very much for being on the call. We will see you on the other side of the starting line for AEP tomorrow. Thank you guys very much for all your time and attention. We'll see you next week.